it's Dr. K, and this is the truth about mental illness. Welcome back, everyone, to the greatest mental health and wellness journey of our lifetime. I am so excited that you're here, and I'm more excited that I get to be the one to bring it to you. Shout out to our caregivers and to our ally angels. So we know what we're talking about today. We are talking about medication and why do people stop taking their meds? Oh my gosh, this was a great question that I got last week, so I'm definitely wanting to just kind of dive into this with you. I'll give you some professional, give you some personal, and share an anecdote at the end here as to why it is I stay on my medication. So let's look at a couple of things I looked up and jotted down, kind of a mix of everything, and then we'll go into my little anecdote here. All right, so I'm going to put these two things like at the same level. That is, I don't like the side effects and I feel better now. What? Yes, these are the top two for me in terms of what I have heard, what I have seen. Oh my gosh. So side effects. We mentioned side effects before. I talked about side effects. One of my side effects is nausea. Oh my gosh. I feel it at least 3 to 4 times a week when I take my medication, but I literally have to power through every single time this happens. It's not like I have like a ready-made day for when I know that this is going to happen. It just decides to happen on that day, and then I just have to be prepared to respond to it. So nausea is definitely a real side effect, and I totally understand why somebody would be like, boop, I'm off the medication train because I'm not feeling like that. I totally get that because you need it to stay in, right? I need it to stay in. I don't want it to come out. Concentration, that's another huge side effect that I mentioned before. I'm going to share that in my anecdote. Let me see some other things. Oh my gosh, weight gain. Totally against the weight gain that psychotropic medications cause. Got to figure out a way to combat that on my own and maintain a healthy weight at the same time. So weight gain is definitely a reason that I've heard and seen and experienced as to why people just do not take their psychotropic medications. Sleeping problems, dizziness, acne, dry skin, all of these things could be a reason why somebody's like, well, I didn't have all this before. So why would I take all this now just because of this one symptom over here, these 5 symptoms over here connected to this brain disorder that I've been diagnosed as having, right? So the side effects are real. The I'm feeling better, this one's a hard one. It's a hard one in terms of like getting through to the person, just because they are right. I am 100% on board with the fact that you probably do feel better because you are taking this medication though. I don't know that it would be the same if you were not taking it. So it really depends on the person, the reason that they were prescribed the medication, what the medication is there to be able to address. But a lot of times I hear clients saying, well, I just feel better. I just feel better, so I don't need to take this. And then they don't feel better again after, a certain period of time from not taking the medication. So just consider that. Maybe you're feeling better because you're taking the medication. Attitude toward medication in general. So for this, I just like to say that I've had clients who do not take medication for anything at all, not even like blood pressure, cholesterol, not even a multivitamin. And then all of a sudden they're transparent with their prescriber and they get prescribed a psychotropic medication. Wait a minute. I don't take medication for nothing. So why are you prescribing me this medication? Because I told you that emotionally I feel like this. So for someone who never takes medication for anything and then you prescribe a medication, that could be one huge factor. Another huge factor in opposition to that is taking too many medications. Oh my gosh, I'm already on this medication for blood pressure, for cholesterol, for my back, for my arthritis, for swelling in my feet. A multivitamin. And then now you want to add something to that? No, I'm good. Like I took it. I feel better. I thought this was a temporary thing. I'm not interested in taking this, on and on and on. I can definitely see that as a reason why somebody wouldn't want to take their medication. Maybe you found other ways of coping. We talk a lot about self-care, and that's great too. Self-care balanced with psychotropic medication can play really well in your favor. But I have seen clients to say, I'm already doing all these great things over here, Dr. K, and I feel a lot better. So I don't need this medication anymore. Or since I started engaging in this self-care activity, I don't feel the way that I did. Okay, we can wait that situation out and just see how things play out. Maybe they don't need medication, ever at all. Just depends. Poor insights. I'm gonna pair this with really not knowing or understanding the true symptoms of the diagnosis as to why the prescriber is suggesting a psychotropic medication to be part of the treatment plan. So we're going to get into another time what are some really good questions to ask your prescriber so that you can understand the medication and your symptoms best, because that's why they're prescribing it. I've seen substance use be used as a reason why people don't take their meds. Like, I have something else that I prefer using, and that's just going to be what it is. Like, I don't need this psychotropic medication. It's going to be poison to my body. I've heard that a lot. I'd rather take something over here that is not, and it is some other type of substance that could potentially have an addictive value if it doesn't already over that person's life, but they continue on and decide that this is the better route for them. Symptoms being gone, I've seen that, and a lot of times with symptoms being gone and I feel better now, it's again attributed to the fact that you're taking this medication and it is making you feel better, so why not stay on it instead of test being off of it? But sometimes we got to do that. We got to test ourselves, and I get that too. But if there's some other contributing factors from your symptom list that could potentially impact you, I would definitely suggest connecting with your provider before you stop taking any medication at all. Insurance coverage, we've mentioned that before. Definitely a value to just have access to your psychotropic medication. Literally just having the access is huge, and we'll get into that as well. But if you have access to your psychotropic medication, have those conversations with your prescriber, have the conversation with your counselor if you have one about the medication and about the value and about your symptoms. Just talk about your symptoms, your criteria as to why they diagnosed you with this particular mental illness, and how this mental illness tends to unfold across the course of a lifetime, be it on medication or off of medication. And then an overall mistrust that I've seen with family members, friends, telling clients, stop taking that medication. You're putting something bad in your system. You don't know what it's going to do. You probably need to stop taking that. And so that person being influenced in that way, also possibly being influenced by, articles that they may have read that talk negatively or bad about psychotropic medication. Again, run these conversations back through to your provider. I do the same thing. If my provider ever suggests a new psychotropic medication, I'm always like, sure, send me the list of everything that you are considering so that I may do my research on my end, because I firmly believe that I cannot pill my way out of life. And I've really got to understand, is it the medication that needs to be adjusted, or is it my environment that needs to be adjusted? And so sometimes it's been my environment that needs to be adjusted. And once I've got my environment together, then my medication stays the same and I'm still good to go. So it just depends. Like, that's just the layers and levels that I take. I don't stop taking my medication, but I do try to go a level and layer deeper in understanding my symptoms and understanding, when they're most likely to, appear and be more stressful in different, environments. And so for me to learn that about myself, I feel like is really critical. Now, here's the anecdotal thing that I said I was going to share as to why I do not stop taking my medication, because earlier on in this diagnosis, I've always taken my meds. Let me just be clear. I've never just stopped or not taken my medication. I don't believe in that. That's just for me, because it makes me nervous as to what would happen if I did. So some years back, I was driving early evening and I was headed to an appointment, and I found myself having driven through a road closed sign. And I'm sure there were signs like layers and layers and layers back on the road telling me, hey, don't go this way. Like, the road is literally closed. Now, thankfully for me, there was not a cliff at the end of that road, or maybe I would not be here communicating with you all, but the road was completely busted up. And here I was trying to drive through it and realize, whoa, you missed all the signs, lady. You need to back up. You need to backtrack up out of this. which I did. And as I was backtracking out of it, I was calling my prescriber, no joke, because I was like, clearly I missed something, obviously, literally. And then obviously in terms of my overall brain functioning, I missed something. So I left her a message. It was early evening. So she did call back, and I sat in a public place talking to this woman on my Bluetooth phone connection about my psychotropic medication, just all out in the open, and asking a million questions about, this other medication that she had wanted me, to try, and so on and so forth. But I did it, and I picked it up that evening from the pharmacy, and it has been working very well ever since. But that was my anecdotal share to say that this is one reason why I continue to take my medication, why I don't fall off. All the reasons that I just shared, I've seen those, I've heard those, I've seen a lot in this space for, almost, 30 years. And I've seen what happens when people have been diagnosed with severe mental illness and have not stayed on their medication. So all of that experience in life as a practitioner, in addition to my own experience as a patient or a client, I know that for me, have to stay on my meds. So I hope that this was informative. I hope that you will share this, because obviously somebody else needs to hear it. I know I'm not the only person out there that has done something quite unexpected when in need of a balance for their overall brain health. So that's all I got for now. We're going to get into questions. I think that'll be next, maybe. What do we need to be asking about these diagnoses so that we can truly understand how they are having an impact over our life, or in some cases, rocking our world? All right. I have nothing else for this segment. Until next time, unto the nations.